Please press on the bell icon and never miss a video from the Aesthetic Clinics from Dr. Rinky Kapoor's channel. So I think people who have, so there are so many different types of skin. There is dry skin, there's oily skin, there's combination skin, and then there's the normal skin. So I think all those who have normal skin must be thankful to God, because God has given them a very big asset. But the thing is that how do you maintain the asset is what is more important, so that you stay with your normal skin and you stay healthy and beautiful all through your life. So normal skin as such is a problem-free skin generally, as in you don't have too much of oil secretion on the skin, so it's not oily, so you don't generally suffer from complications which are associated with an oily skin, like severe acne and pimples and dandruff and so on. And on the other hand, the skin is not very dry as well, so you don't suffer from problems of dry skin, that is eczema and so many other things that are associated with dry skin. So normal skin is generally healthy skin. It's not very oily, it's not very dry, the skin feels normal after you wash it with a regular face wash. And what you all need to know is just to preserve your skin type. So normal skins generally, all products suit them really well. So I mean, they don't have complications much with using any particular type of makeup or any particular type of moisturizers or toners, etc. So they could just follow a normal simple routine of cleansing, toning, moisturizing and using their sunscreens. They cleanse with a regular cleanser, they which could also have some botanical products so that they can have a good glow to the skin. Then you can use a good toner so that your pores stay tight, and followed by that you can put a light moisturizer on the face, which helps to prevent aging as well as maintaining the suppleness of the skin. And then you follow it up with a sunscreen, which could be a tinted sunscreen, non-tinted sunscreen, and most sunscreens suit patients who have a normal skin type. So this is what you should do to maintain your skin. In addition, you can do some procedures if you want to maintain your youth and you don't want to age very fast. You can also go in for procedures like a microdermabrasion, which you could probably do once in 1 or 2 months, and you could go for a light chemical peel for regular exfoliation of the skin to maintain the health of the skin. In general, patients with normal skin are blessed with good skin and they should know how to maintain the skin. Of course, your dermatologist is the right person to advise you on how to maintain yourself, and that should be pretty good skin to maintain. Thank you.